My passion for working in dementia care really comes from knowing that what you're doing makes a difference. We can see through our research when we share the findings with people with dementia and their families or people who care and support for them, how they can take that into practice or into their lives to improve things and make things better. I'm Professor Claire Surr, Professor of Dementia Studies and Director of the Centre for Dementia Research. Dementia is a global condition that impacts millions of people worldwide. There's no cure and we don't have a treatment for dementia that can do anything apart from slow the progression. Our research helps people who are caring and supporting for those with dementia to be able to do that as well as possible. Actually, you can live a good quality life with dementia, and until there is a cure, we've got to find better ways to care for people with dementia. We've done lots of different projects that have had impact in different ways. One recent study was looking at how we best train health and social care staff so that they're able to put that into practice to deliver better dementia care. The findings from that have been implemented nationally in England by Health Education England as their gold standard for what quality dementia training should look like in terms of how it's designed and delivered. And they've also been picked up internationally. We did a study recently looking at the needs of people who've got dementia but also a diagnosis of cancer. So we went to local hospitals and we attended with people for their cancer appointments. So a researcher met the person with dementia and their family member at the door of the hospital. So we really found out what people's experiences were like. From that, we were able to come up with a list of recommendations of things that oncology services could do differently to improve things for people with dementia, like better recording of dementia in the hospital medical notes, providing things in picture and written format, explaining the diagnosis and the treatment and making the hospital more dementia friendly in terms of finding your way around the corridors or having things to do in waiting areas. And what we found was huge engagement from the clinicians. So one of the hospitals who took part in the study have really wanted to go with the findings. There's a lot of personal satisfaction, and I think particularly when you can talk to clinicians and work with them, or people work in care homes to put your research into practice, and people get excited about it. But we do a lot of work with people with dementia and their families, so they're involved with us and they then talk to us about how brilliant it is to see the research in practice or what a difference it can make.
Academics at our university listen, inspire, challenge and innovate. They transform the way our students think and view the world. See how our academics and their research is making a real difference.